I'm going to go over the agenda, and then as soon as we do the agenda, if my colleagues from ScreenWise don't mind, we'll just kind of go. I see everybody's face in front of me. Oh my gosh. We'll just go straight down the line from Wendy all the way to Kendall, so you know who from ScreenWise is joining us today. And we will definitely volunteer our first name, our last name, our pronouns, and our role in this lovely program. So our agenda for today. So today we're going to go over the ScreenWise mission and commitment and approach. And then the responsibilities of ScreenWise providers, the services, and then also the patient eligibility, and then thinking of patient enrollment and data reporting. And then we'll talk a little bit about what happens when cancer is diagnosed, and then go to billing and claims. And we're going to talk a bit about the EOB, or explanation of benefits. Then, of course, our questions, and then contact information. And so I'm going to do we'll start the quick round of introductions. I'll start with myself, Mika Webb, pronouns she, her, hers, and I'm the Health Education and Communications Coordinator. Wendy.
Hi, I'm Wendy Jacobs, pronouns she, her, hers, and I'm the Quality Assurance Coordinator for the ScreenWise program. Welcome, everyone.
Hi, I'm Emily Hagel, and I'm the Billing Specialist Coordinator with ScreenWise. My pronouns are he, she, her, and hers, and welcome. I'm happy to see you all.
Hi, good afternoon. My name is Zuri Lopez, pronouns she, her, ella, and I am the Equity Access Coordinator. Welcome.
Hi everyone, I'm Kendall Reese. I use the he, him series pronouns, and I'm an admin specialist with the Oregon Health Authority.
Thank you, everybody. I don't know, so I'm just going to check just in case. If there's anybody else on the screen from the ScreenWise program on the call, would you mind introducing yourself? We'll give it a half a beat. Okay, I don't hear anybody. So next slide. Poll question. So our first poll question for today. How long have you been with the ScreenWise program? Over 3 years? A few years? Less than a year? Really new and learning? Those are your options. Please pick one. I think we should be getting the results soon. Perfect. So I'm just looking at the results. Wow, this is so interesting. So we have about a quarter of the folks who've been with the program for over 3 years, and then about maybe a third, a few years. A smaller percentage, around 10 to 12, have been with the program for about a year, and then about another third are really new and learning. So this is a good group. So it's going to be a good mix, I suspect, of questions. Questions from the perspective of, I've been doing this program for 4 years, and this is where I'm stuck. Can you please clarify? All the way to, I just started last week. Oh my goodness. How can I figure all this out? What are the shortcuts? What do I need to know? Let me know. So this is a good group to be in because we get questions from all perspectives. And so I'm glad that we can all share today. Next slide. So these next few slides, just to give everybody a sneak peek, is just background on the ScreenWise program. So I'm gonna kind of go through them a little bit quick because I know that at the end of the day, we're all here because we really want to see the rates of breast and cervical cancer decrease. And the best way to make sure that happens is through screening and diagnostic services. So what is the ScreenWise mission? At the end of the day, it's really about reducing inequities in breast, cervical, and hereditary cancers. And how do we do this? Through screening and early detection. Next slide. So in looking at that idea, ScreenWise is really committed to health equity. And so it's really about making sure that we have resources for all segments of our community, especially those who have been marginalized. So thinking of communities of color, thinking of those who are even out in the rural sections of Oregon. It's really about making sure that we provide services to folks who are not always in the main fold, in the main mix. Next slide. And then if we're thinking specifically about populations, who are we talking? We're talking our BIPOC communities. We're talking about our communities that are rural. We're talking about folks that are rarely or never screened. We're talking about folks that are 50 plus for mammograms, folks who are experiencing some sort of disability, folks who are a part of our LGBTQ communities. Next slide. And then if we want to drill down just a little bit more, how might you see ScreenWise? You might see it, well, actually you see it every day through what you do, through being a direct service provider, through being through our clinical services. So that's really about making sure that there is access for breast cervical, excuse me, for our breast, cervical, and hereditary cancer screening and diagnostic services all throughout the state. Or you might even see it through health systems changes. So that's EBI, but what does that really mean? How can we work together to make sure it's easier to identify and flag our patients, our community members that come in and become our patients, to make sure they're getting their screenings early and often. And then our community clinical linkages. Our CBO partners, those out and about in the community, those who have a pulse on the community, those who are trusted figures, that it's really about providing that education piece and then encouraging those folks, once they get the education, to utilize the providers in our network. And then environmental approaches. You can kind of think about this if you've ever been to a health fair at your work site, and they have screenings, they have health education. It's really about how can we make this whole idea of being screened early and often more accessible. And then genetics. That's really about providing that education piece about family health history so that folks can have those conversations and know if there is a risk for breast cancer in their family, and they can make sure that they can get screened and get the services that they need. Next slide. So I'll turn it over to my colleague, Wendy. It's nice to see everybody. I'm gonna turn off my camera because everything is going a little bit wonky now.
Hi, everyone. I'm going to start with some general connections between ScreenWise and our enrolling provider base that connect patients with direct services to screen for cancer. That's why we're here. So the responsibilities of the ScreenWise enrolling providers, this is to provide culturally appropriate trauma-informed care and care coordination. So we know that you're doing that in the field and we feel comfortable with that partnership. The next one is that the clinics themselves will either the front office or whomever is, there could be the community health workers, the folks that are connecting the patients with the ScreenWise program and getting them enrolled with us are the ones assessing the patient eligibility and obtaining informed consent, as you would be the record holders for the patient. What happens next for that patient, you know their full history. Also informing patients of the covered services under the ScreenWise program. We know that they come into the clinic for various purposes and it can be lumped together, but we want to make sure that they understand when they're signing up for ScreenWise and signing that consent, they know what is covered through our program. Along with these very important pieces is documenting and retaining records. And so as I was saying before, when you are the record holder for the patient and you know their history and more information than what we ask for, you are able to direct that patient on their next steps in their journey to make sure that they're cancer free. Also submitting that data to ScreenWise, getting it to us quickly, and so we can get them enrolled and such. Also, navigating patients through the cancer treatment process, if it is found that you help them along the way with financial aid application procedures. And Zuri will go into that a little bit more as well. And what do we do? What do we cover here in our program? We know that patients come in for a well woman check and they may be having other things that are being taken care of, testing for various other health issues at the same time. But this is, in general, these are the services that ScreenWise provides. Breast services can include the CBE, the breast exam, screening mammograms, diagnostic mammograms, abnormal follow-up procedures such as ultrasound, fine needle aspiration, biopsies, anything that's needed for that diagnosis. Also, genetic counseling and testing as related to hereditary breast cancer. On the cervical side, the standard screening procedures, pelvic exams, pap smears, HPVs, and any abnormal follow-up that is needed that comes from those test results, such as a colposcopy, diagnostic leaps, things like that. And then in that vein of the services that we provide, Zuri is going to pop in here and talk about the resources that are available for, oh, nope, sorry, wrong order. I'll keep going. ScreenWise genetic counseling and testing is a part of what we cover. How do you qualify? Well, the patients would need to be eligible for breast and cervical cancer screening first. So once they are eligible, then they would be able to have the genetic counseling and testing done. So if they are currently enrolled in the ScreenWise program, they would be eligible for this service as well. Patients must be referred by ScreenWise provider, you all, to a ScreenWise cancer genetic clinic specific that's partnered with us, and we can provide those resources. And then the ScreenWise genetic counselor will refer the patient for the testing itself. That's the blood work. The services covered. It covers up to 2 hours of pre and post test genetic counseling. And we do the genetic testing for the BRCA1 and 2 gene. If you need additional information, there is, well, actually just call our main number and we will make sure to get you some resources for that information. All right, so eligibility, there's a lot of questions that come in about this, and I'm going to try to make this as simple as possible. This chart is located on our website as well, and you have it in your email now. So I'm going to go through these just in order, and if you do have questions along the way, please go ahead and use the chat box, and we'll make sure we cover them in the Q&A session at the end. So for the age categories, folks that are aged 21 to 49 who are needing breast or cervical cancer diagnostic services are eligible for the ScreenWise program. And that is if they come in having a need, let's say there's a pre-existing condition or a status with an abnormal PAP, for example, and then it is known that they need a colposcopy, then they would automatically be eligible for our program if they're under 50. Or if they are needing additional imaging, if that's something that is a standard and a pattern for this patient, then they would be eligible for our program. Folks that are age 50 and older, they can come in at the screening or the diagnostic level. And so if for standard mammograms and PAPs and HPVs, that's all part of the standard screening. So you can go ahead and enroll folks that are 50 and over right away from the start for our services, or if they are coming in at a diagnostic level as well, either way. The location specification is if the patient either lives in Oregon or intends to live here, so they can use an address of maybe a family member, they're moving from out of state, or they're here working and they're going to be here for a while living. So And again, we do not ask for any kind of verification or documentation of any of these categories. So I'll keep going with that in mind. The income level, we offer eligibility at or below 250% of the federal poverty level. And so it's a pretty generous amount. And we do have a chart on our website that has the number of people in the household and how much that gross monthly income is, that threshold for eligibility. So you can refer to that often as needed. Insurance status, this is a good one. Patients, if they don't have any insurance, they are eligible, or they might have insurance, but it's a financial hardship or it doesn't cover standard screening procedures. So if they have emergency insurance, that's just for traumatic events or child pregnancy and childbirth, and they may be eligible for our program. It could be as generous as if their portion of out-of-pocket costs is going to put them in a financial hardship. So co-pays, co-insurance, deductibles, all of those things all would make them eligible for our program. So just because they have insurance doesn't mean they'll automatically not be eligible. Okay, so the enrollment requirements, we have an intake packet, and that's all the things that you need to fill out, and I'll go through that in a moment. But this is in general, in order to assess if a patient is ready to go and get enrolled into the ScreenWise program, you want to make sure that any forms that you submit, and this goes for the enrollment as well as all the forms that we ask for, that you make sure that we can read them, that they are thorough. And for me, who nobody can read my handwriting, we do have PDF fillable forms on the website, so you can go in and type in all the information and submit it that way. We don't have the capacity. There's just a very small amount of us. There are 3 people that process the data, either from enrollment and results perspective or from a claims and billing perspective. We don't have the ability to let you know everyone that has been enrolled, but we will automatically and quite quickly let you know if someone is not eligible, or if the form is incomplete and there's some reason we can't enroll them into the program. So make sure that you definitely respond to any emails that you receive from us after we've reviewed the document, and take a look at what's missing. We'll indicate what we need on the email, so you can correct it and resubmit it, or maybe not, maybe oops, they weren't eligible. So that's a bit of information for you to be able to get your folks in the system as soon as possible. Make sure that you do respond to our emails. So the intake packet or the enrollment form, it has to be received within 5 days from the date of service. And this is primarily to prevent the patient from receiving a bill. Those claims for, let's say the patient's referred for a mammogram and they have their imaging done right away, which would be lovely if that happened. Those claims come in really, really fast. And so we want to make sure they're in the system and we don't deny them. We don't deny the payment of the claim. All right, so the other forms, I'm going to go into kind of review the first form again. This is the enrollment form, the intake packet. It's required for all patients, and it includes patient demographics as well as the real D and consent, signed consent. There is also a page for the services that are being ordered, which includes reasons like cancer risk and history, as well as what specifically is being looked for or done for this patient. And remember to return that within 5 days of the date of service so we can get them enrolled as soon as possible. The next form is the result form. And this is also required for all of your patients that you enroll into ScreenWise. And this is where you report the initial services that were ordered, you report their results. And also you're indicating the follow-up recommendations of if there's more testing that's going to be done, or if everything looks great and they're good to go until their next screening or need for diagnostic. So you want to send that results form in as soon as the results are known. So that mammogram, HPV, PAP, you send that in as soon as you know what the results are. All right, and the final outcome form, this is not due, you don't have to submit this for every patient. This is where if there are additional diagnostics that are needed to rule out cancer, let's say they have a mammogram and there's dense breast tissue and they need to have some additional imaging or fine needle aspiration, it culminates into a biopsy, you know, different events happen. This is where you report what that final outcome was, what was the final diagnosis for that patient. And also if there is a precancer or cancer diagnosis, this is also where you would report the treatment status, if it's not needed, if it has been started. And that's a very important part of your role, is to make sure that we report to the CDC on what happened with every patient that's been enrolled in the ScreenWise. So the form will direct you on everything you need to complete out. And we do have tutorials on the website for each specific form. Forgive me, it's my voice and it's strange, but it'll guide you through. And then you want to, just like with the results form on the final outcome form, you want to return those as soon as you know what that final outcome is and what's decided for either treatment or follow-up for that patient. All right, and then the provider data reports, that is another resource for you as far as checking in. It works in a couple of ways. This is something that's sent out each month via our secure email portal, and it's sent to everyone that is designated a recipient for this report. So if you need to be added, if you have staff transition, we can definitely update that for you. My contact information is right here, and it will be on the end of the PowerPoint slide as well. It's in an Excel spreadsheet format, and what this is, it has all of the unknown results or final outcomes for your patients. So anyone that you have enrolled, not only for your agency, but right down to the specific site. If you have multiple sites within your agency, you'll get a report for each site. And it will indicate anybody that you've enrolled and we do not have documented, we've not received any documentation for what happened to them and what their final diagnosis is or their results. So take a look at who in your staff would best be the person to receive this, and indicate to us if we need to, if you're not getting this report, you need to be added. We can definitely change that and get that out to you. So you do want to fill this in and return it via the secure portal. So you can just hit reply after you're done with it and send it right back, and it'll be secure within 2 weeks of getting it. And that's because it's just me entering this information. So I want to be able to make sure that when your new monthly report comes out, that all of the missing data that's been submitted on this report is input into our data system, and that name doesn't repeat on your list. It only arrives once. And we do this for a couple of reasons. We do it to fill, it's a gap filler. It's in case a form doesn't come to us, it makes sure it's like an alert that lets you know that we are still needing some information for one or a number of your patients. And also, if you don't receive one of these reports, that's okay too. If you're a recipient for it and you don't get it, that just means all of your patient outcomes are known. So we don't require you to resubmit forms. You can use this Excel spreadsheet to report the outcomes and results for your patients. It's an easier way, instead of digging up old records that may not have arrived to us, of documenting those results and communicating them to us so we can close out the patient files. All right, so I'm going to turn this over to Zuri, who's going to be talking about what happens when a patient receives a cancer diagnosis. Thank you.
Thanks, Wendy. So ScreenWise is as committed to providing screening services for the community. We also recognize that there is a gap in our systems at times when finding access to oncology services. And so we are fully committed to be able to support our community patients, but also our providers, the providers in our network, to ensure that there is a warm handoff to these services. While ScreenWise services do provide all the diagnostic resources, our services do stop at cancer treatment. So in our efforts to be able to fill that gap, we have put together a financial assistance resource document, which intends to provide a list of all of the larger health systems within the state of Oregon to provide access, that could provide access to oncology treatment, primary care, specialty medical care, and pharmacy. We have done the legwork, we have done the research into looking into each of these larger health systems to ensure the type of coverage that they offer, what they can offer, and the duration of. So basically eligibility requirements per larger health systems within communities in Oregon. Currently, what is published and is on our website is Tri-County. So you'll see Washington County, Multnomah, and Clackamas, in addition to Marion and Polk. That is what is published and is up to date with the most current information. And we are currently working on our, so we're working south of Oregon, and we're still in the process of doing all the legwork for the larger health systems. Then our intention is to have a completed list of all the regions throughout the state of Oregon. So that is a resource for all communities. In addition to the financial assistance documents found on our website, which are listed in Spanish and English, you'll see those in both languages. There is also an updated tab for the BCCTP program, so the breast and cervical cancer treatment program. That has also been updated and is available as a resource for you as providers, but also for patients. While this list does provide access to oncology services, it is also a resource for primary care or specialty care services. Thank you.
Thank you, Zuri. All right, so we have, and definitely include any questions that you might have for Zuri or any of us, and we'll address them at the end. I see a few in there. That's wonderful. For now, we have another poll. And for those that can't see this, if you're on your phone, what is the due date for submitting the ScreenWise intake packet and which is the enrollment form? On the date of service, within 3 days of the date of service, within 5 days from the date of service, and once the results are known. I'll just give it a minute here. I think you guys got this. So it is within 5 days from the date of service. We don't mind if they come in the same day they are seen, the patient is seen or referred out for diagnostics. Just as long as they don't go beyond the 5-day threshold to make sure we get them in our system and properly enrolled so we can pay those claims. And the next question, what is the best way to make sure your patient gets enrolled into the ScreenWise program? We have options of pre-screen for eligibility, submit thorough and legible paperwork, call ScreenWise staff to see if the ScreenWise intake packet has been received, email ScreenWise staff to see if the ScreenWise intake packet has been received. Most folks did answer pre-screen for eligibility, submit thorough and legible paperwork. That is correct. There are a few exceptions where you may not be totally sure that if somebody's borderline or it's a complex situation, you can call us. we are a pretty tiny team, and so your best shot for making sure that get enrolled really quickly is making sure we can read all the information on the intake packet, and that they are eligible before you submit them. So there's no lag between having the patient sign the paperwork and then us telling you that the patient isn't eligible. And I'm happy to address any eligibility questions that you might have as well. Thank you.
Okay, time for billing. So I'm going to start with the basic billing points that you'll need to know. And the first one is that all of our services are contained in a list that has the CPT code, which is the current procedural terminology for the service, along with the ICD-10, which is the diagnostic code. It has a description of the service, and it has the rate at which we pay. That list is located on our website. We're going to go through that website just very briefly to show you what that looks like at the end of this presentation. But that's where the list is contained. I do want to shout out and make a note that we have just today been notified that there is an error on that list, but we want you to go ahead and use it anyway because our system is set up to pay the correct amount. But we are working on getting that changed and getting it switched out and posted with the correct one. It's just a little tiny difference in payment for some of the office visits. We do cover telehealth visits, and that we started at the beginning of the pandemic, and we're going to go ahead and keep covering those until further notice. All the rates and codes are updated yearly in accordance with CDC, and we publish those right around March 1st of every year on our website. The rates are, that's when they go ahead and update those rates every year. You can submit health insurance claim forms, which are the standard 1500 or the UB04. We also have simplified claims located on our website that you can use if you prefer not to use the standard ones. On those ones, you just go ahead and fill in the date of service, you circle the CPT code that you want to use, fill in the diagnosis code, and then go ahead and submit it once you fill out the top information. And just a note, those rates on those claim forms are also incorrect, and they will be corrected along with the other document that I mentioned. The best way to send claims to our program is via our secure portal, and there's more specific information about how to do that on our website. You can also fax the claims or mail them by regular mail, but please note that those ones that are sent via regular mail are delayed, obviously, and they will be filed at a later date. We only process our claims once a month, right around the 9th. So that just because we're not a regular major insurance company that processes everything in real time, we only process once a month. So if your claim is not received by the 9th of the month, it will not be paid until the following month. Claims have 365 days to be submitted or reconciled. So that's a really generous amount of time to get things paid or corrected if there's a problem. All the payments are generally received at the end of the month. Sometimes they're delayed a few days if there are holidays during that month, but generally it's right around the end of the month. Next slide, please. So when you enroll a patient, one of the most important things to make sure that we need to do to make sure your patient doesn't receive a bill for a covered service is to make sure that the ancillary provider knows that the ScreenWise is the payer of that service. So when you refer your patient for a mammogram or when you refer her labs out for laboratory services, please make sure that you either use the referral form located on our website, or you clearly mark that ScreenWise is the primary payer. What you can put it under insurance, or you can put it under, you can even just stamp it right across the top, however you want to do it. We recently had a situation where a patient got that referral form was faxed over from the enrolling provider. She went in for her mammogram. There was nothing on that referral form that said ScreenWise. She went ahead and paid $600 of money that she didn't have. She put it on a credit card, and now we have to work to get that patient reimbursed. So that's a good example of, and that's a very traumatic thing for a patient to go through when she's been told it's a free service. So luckily we've gotten that taken care of, but that's why this is so very, very important that you clearly put ScreenWise on any referral forms. And it's also good to make sure your patient knows that if she's asked, you know, when she goes for her mammogram, do you have insurance? Don't just say no, say I am in the ScreenWise program. And that's helpful too, so that she has the ability to advocate for herself too. Next slide. So yeah, the reasons that patients are billed for ScreenWise covered services, and it does happen, but there are two main reasons. We do ask that when you enroll patients into ScreenWise that you do let them know. We're working with large health systems. There's a chance you might receive a bill. If you do, don't pay it and don't ignore it. But you know, let that patient know that they need to contact you as the enrolling provider. And if you need help with that bill, you can contact me. So the two main reasons are that if we don't get those intake packets within 5 days of the date of service that she was enrolled, that leads us to deny the claim because we don't see her in our system and we have no way to file that claim and pay that service. And then the second one is the one I just talked about. If ScreenWise isn't clearly marked on the referral form so that the ancillary provider knows to bill ScreenWise. Those are the two main reasons patients get bills. We want to avoid that at all costs because that is not, that's very traumatic to the patient, and patients aren't supposed to be billed for their services. So this is it's kind of our rule about out of scope services, that you can only bill a ScreenWise patient for non-covered services if you comply with the following protocol. And I'm just going to summarize that if a patient comes in for an office visit for a well woman exam, and that patient says, you know, I want to get some STD testing, or I would like to get a flu shot, or any other services that may cost, are not covered by ScreenWise and may cost extra, they can go ahead and get those services, but you as the provider must inform the patient in writing that the services that they're receiving are not going to be covered by ScreenWise, and so that patient will be responsible for them. And so basically, if you don't provide that in writing, or you don't let that patient know and get her consent that she's going to be responsible for them, neither ScreenWise or that patient will be responsible for that charge, and it will be the clinic that you know failed to let her know. So we just really want to avoid patients coming in for stuff and leaving thinking everything is covered by ScreenWise and then get a bunch of surprise bills. We want no surprises. Next slide. So the explanation of benefits is something that you're going to receive once a month. The way that we send these out are via secure email to the EOB contact that you have provided us with. So we have the list, and every month we send out that explanation of benefits via secure email. Unfortunately, we are unable to send them together with your payment because our payments come from Salem. The EOBs come from our office, which is in Portland. The top of the EOB is in an Excel format, which is why we can only send it via secure email. We can't fax it, we can't mail it. The top of the EOB shows you the batch date range, or the date that the date of the range that the dates of the claims that are covered. And each month of the calendar year has a tab across the bottom so that you can go back and view every EOB for the calendar year. So obviously in January, you're only going to have one, but as the year goes on, you'll be able to go back and see other EOBs if you have questions around whether a claim was paid, or if you're not seeing a payment for a patient, you can go back and try to find him or her. And there's my contact information at the bottom, so you can always feel free to call me or email me if you have any questions regarding claims or billing, if a patient receives a bill, any of that, or any EOB questions also. Next slide. So the ScreenWise program offers a reimbursement of $33.45 for every patient that you enroll. And that's to reimburse you for doing all the paperwork, for enrolling the patient, determining eligibility, submitting all the forms. I don't mean to say all the forms, there's not very many, it's pretty simple. But the CPT code to use for that is 99080. It's the very first claim located on our CPT code list. And on the simplified claim, you can circle the result RESLT or 99080. You want to have the date of service be the same date as your office visit. Diagnosis code should be the same as your office visit. But please don't forget to add that on there to your claim when you file the claim for the office visit. You can also send it in separately at a later time, but just don't forget to do it. And the reason for this is that we're a grant funded program. So our grant money goes from year to year. And if we have all of our clinics forget to do this or just choose not to do it, we end up being underspent. And then that kind of sends a message to CDC that we don't need all this money. Well, then guess what happens is we get our funding cut. We don't want that. We just want to reimburse you for the work that you're doing and participating in our program, because we know that it doesn't pay a lot, but we really want to call attention to this. So if you ever have questions about this, just holler. Next slide. Okay, so we have our final poll question, and then I think we're going to take a quick peek at our website so that you guys can get an idea of how that's organized. Does anybody want to read this, or should I go ahead and do it? I'll read it out loud for the poll question number 4. What was the most helpful thing that you learned today? The scope of the ScreenWise services, the eligibility guidelines, how to submit patient documentation such as forms and missing data reports, or where to go for billing stuff. Yeah, you want to know if you're interested in billing or not. And then you can also submit all of the above. I guess choose all of the above is what I meant to say. Okay, so that looks very evenly spread, with the majority, a landslide, of you wanting to know all of the above, or the most helpful thing was all of it. So that makes us feel really good. I appreciate that. It looks like we're on the right track to answering a lot of your questions. I think that we're going to take a peek, Kendall, at the website real quick, and then we'll go ahead and start with question and answers, unless Wendy or Mika or Zuri have anything else. Next slide. Okay, thank you, Kendall. So this is a quick peek at our website. We do have on our final slide, we will have the link to this website so that you guys can go in and check it out. But we'd love it if you would bookmark it, because this would save a phone call, an email. If you have a question, most things can be found on this website. So on the left-hand side under the home where it says ScreenWise Services, there's a few different tabs. We are working on getting this a little bit more user-friendly. But if you could scroll down just a little bit, yeah. So if you can see the one I'm familiar with is the billings and claims, and that's the one where you can go in and find your CPT code lists and your simplified claim forms, that kind of thing. The one below that is the genetics services. I'm going to have Wendy chime in if she wants to explain the difference between data and data forms. I think data forms
Sure.
Sorry, Wendy,
That's okay. We are working on fixing this, and we've gotten some feedback from providers. It's a little confusing. So for now, I think as far as finding the forms, let's see, provider manual and data forms right above billing. Yep. That is where you'll find the forms. That is where you'll find the form tutorials and also the program operations manual. So that is probably the most commonly used forms. And then up above those in the becoming a ScreenWise patient and participating providers, in there you will find the eligibility guidelines, and also if you're when a patient calls in, we will walk them through how to find a provider in their area. So all of the clinics that are partnered with our program, we have a map. And we send out a survey every year that we find out what services you provide and your hours of operation. You know, things have changed with everything going on in the world. So we find out, you know, generally how your clinic works, and we put it on a map. So you have folks in the public sector can go in and look at where all of our clinics are, and then find out their hours and contact information and what services they provide. So it gives them a good start. And those are what those tabs are mainly used for. And we will have this a little bit more user-friendly, but for now, go ahead and click in there when you have some time to see what's under each of these options. And then in the center, where it says cancer prevention and treatment resources, this is where the resources that Zuri was talking about for the cancer treatment financial resources options are. So we have right in the middle, there's the breast and cervical cancer treatment program, or the BCCTP, and that in there has the guides and also contact information for Oregon Health Plan, which is who runs the BCCTP program. So you have phone numbers to call, an application to help the patients fill out, as well as instructions on how to fill out that application. So we have kind of community connected those resources for you in one place from our website, so you don't have to surf around too much. And then down at the bottom, the financial assistance resources, that's specific to what Zuri was talking about. You can click in there, and there's in English and Spanish, there's all the different resources. As we find them and confirm that they're current, they're listed in there.
And then I also wanted to call your attention to the contact us. Well, actually over on the right-hand side about ScreenWise, there's our racial health equity values and principles. And right below that is learn more about ScreenWise. I'm not entirely sure what all is in there, if that's going to be updated, but it's just kind of a summary about our program. Below that is the contact us button, and you will find all of the people on our team that you can contact if you need to make a phone call to reach us or send an email. All of that is there. And I think that's it. There's a lot of information as far as billing and claims, under billing and claims, that I did not cover, and those include things like if you as a provider feel that there is a procedure or a service that is necessary to determine breast or cervical cancer, but it's not on our covered services list, there's a clinical exception form that you can fill out and send in. There's also an optional referral form that you can use. There's also an optional out-of-pocket cost form that you can use for the patient to have her fill out, to let her know what services she may be responsible for paying. And then the one right below billing and claims has information about our genetic services, and that has an in-depth information around what clinics we work with for genetics and things like that. I think that about covers it. This is a really good website, and it's only going to get better as far as containing information about the program. And as always, if you guys have any questions about anything on it, just don't hesitate to call or shoot us an email.
So this, go ahead, Mika.
Oh, no, I was just wanting to, yes, you go, Wendy. Sorry. I didn't know if we were going to go into questions and answers or not. Jumping the gun.
Indeed, indeed. We can definitely do that. And while we do, we'll have this resource slide up for you. And don't bother writing anything down. We're all here through the website. We're listed as well as in this this slideshow presentation. But yeah, we can launch right into the Q&A, starting with
we do have a link to our website right there. So if while we're doing question and answers, if you guys want to go into the website, poke around, and if you have any questions pertaining to that also, you can go ahead and pop them in the chat.
So I will go through all the questions in the order they came through, just to make sure that we respond to all of them. And as Wendy, Zuri, and Emily have already said, as questions come up, please put them in the chat. And if you have more questions at 3:35, please send us an email. So our first question is about eligibility. And I'll read the question. If a patient is in proper age range, has insurance, and is below the 250% federal poverty level, and their co-payment or deductible makes it a hardship to get the testing, can they apply to get help through ScreenWise?
Absolutely. Yes, and please. Yes. And it doesn't have to be all of those situations where they have to fall into all the categories of age, residency, and income and insurance level, but any one of those can be enough to make them eligible. So for the income portion, again, that it can walk a fine line where somebody has Oregon, either living in or intending to live in Oregon, is pretty much a clear-cut standard. But and then also the age piece, that part of it makes them eligible at certain levels. And then the insurance piece is where it gets a little bit tricky, I think. So if the patient is they have insurance, you know, and there's something that's going to make it a financial hardship for them, definitely, if you have questions about that, you can contact us by email or phone. You can contact me directly if you like, or Laura Hunsinger, who isn't on this call, but she's the person that inputs all of your enrollments into the system. So she has all of this information down as well. So yes, if anything coming out of the patient's pocket is going to make it difficult for them, then they would be eligible for our program. So that is an option. We are the payer of only resort though. So if they do have insurance and they are eligible for our program, because let's say they have a $2,000 deductible before it will kick in and cover, then they would want to, all the claims and everything would be submitted through us, and they would be enrolled into our program. For
just to add to that, so you would not submit anything to the patient's insurance. You would submit it to ScreenWise only, and then at that point you accept the Medicaid rate as the payment in full. So we're not a secondary payer where we cover what's left after you bill our insurance. Just to make that clear. It's really confusing sometimes.
Thank you both for the clarity. Next question. So excuse me, can you please send the Excel format you prefer to receive the data in to the participants?
We do email the, if I'm understanding this question, feel free to jump in if I am not interpreting this correctly. We do send the report with the missing data and patient outcomes. We send that out once a month in an Excel format. And so you can submit that, you can fill out right on the provider, it's called a provider data report, that monthly missing data report. And you can either write in there what the answer is to that question of, let's say there's a missing mammogram result. So you would list the date, the result, the follow-up recommendation, and the final imaging. So The mammogram was a BI-RADS 1 and it happened on December 1st. And this is, we recommend routine follow-up. And so you can either type it right in on the Excel spreadsheet, or you can opt to highlight. We have all of the answers that are on the form right on the Excel spreadsheet to make it really easy. And you can just highlight that column in, let's say, yellow, whatever your color preference is. And I'll know that that is the answer for that patient. I hope that answers your question.
Thank you, Wendy. And please let us know if you need more clarification. Not a problem. Excuse me, next question. Do the results have to be sent over via the results form, or can we set it up to automatically fax all patient reports to ScreenWise?
Brooke, hi, this is Brooke from OHSU. So Brooke and I noted Andrea and Chevin are on the line from our partner there. OHSU has a little bit of a different setup that is happening. And so my answer for you would be different than it would be for the rest of the folks that are on the call. Basically, you can report the results in, as we had talked about with regard to that provider data report. You'll be getting that same kind of report to send in those results for those patients.
Thank you.
Yeah.
Next question. If the patient enrollment packet is submitted day 6 or more after the date of service, is the patient ineligible for ScreenWise services, or what options are there for the patient at that point?
That's a great question. I'm really glad you asked that. They are not ineligible. That is mostly, we have that 5-day deadline in order to prevent the patient from being billed. And so we know that we can get them in the system. If you send it within 5 days, we have enough time to get them in the system before a claim comes through. We do have, there is a retro enrollment eligibility. So if a patient happens to come in, they sign up, but they've already had their mammogram, last month. We do have a 90-day retro enrollment, meaning we absolutely do not want you to hold on to any paperwork for enrollment purposes for 90 days. But if the patient circumstances that they haven't gotten enrolled yet, but they were eligible at the time that they had that procedure and it doesn't go back any more than 90 days, then we can cover that for them and we can backdate that enrollment. So whether it is something in the past, which doesn't happen too often, but we do have that safety net in case it does, or if it's maybe it doesn't come in right at the 5-day mark, they are not ineligible, please sign them up for sure. And then we will do our best. I would suggest a good tip. If you have there's always the exception to every rule, right? So if there is some paperwork that didn't get to us and it is over a month or it's a couple weeks old, definitely call us and let us know, Emily and myself, so we can take action accordingly, prioritize things. Our goal, because we do have hundreds of these enrollments coming in on a weekly, if not daily basis, we want to make sure that we can get everybody in the system as soon as possible. And so notifying us if there is a concern, if something has gone wrong and outside of your control, or if there's a need to backdate an enrollment, that the patient was eligible for something that happened a month prior or 2 months prior, that is okay. Just make sure that you contact us and we can help out.
Also, if you receive an email from me saying we need your intake packet for the following patient, please don't ignore it. Please respond. Even if you think you sent it in or you did send it in, it could be for some reason we didn't get it. Also, if an ancillary provider calls you or faxes you and says this claim got denied because the patient wasn't enrolled, please go ahead and send the intake packet in, even if you're sending it in again. Those are the things that we have in place to go chase down intake packets that we haven't received. And then the other thing is if you see on your EOB that one of your claims has denied because the patient is not enrolled for the date of service, that's another clue to please send in the intake packet. All of those are ways that we have of making sure that we get those intake packets that didn't get in within the first 5 days.
Thank you both. And then there was a FYI for us from Amy, and thank you, Maggie, for the follow-up. But essentially, there is a broken link, and I believe it's under the how to submit a claim page. And so we'll work on getting that fixed and updated so everything is ACEs soon. So hopefully by tomorrow at the latest, tomorrow afternoon, we'll get all of that fixed. And then either way, we'll make sure before the follow-up information from this session is sent out, that link is fixed. And thank you, Amy and Maggie, for your assistance on that. And I'm just going through. Okay, next question. Once a patient is enrolled, and if the patient ends up needing additional breast imaging / biopsy after initial enrollment, does a claim need to be submitted for each additional item? And then there's another question after that.
I'll go ahead and take that one. Once a patient is enrolled and the patient ends up needing additional breast services, the ancillary provider is the one who bills us for the ultrasound, the mammogram, the biopsy, any of those services. However, if the patient needs to come back into the office to do a follow-up visit for something that was found abnormal in her imaging, et cetera, you can go ahead and file an additional claim to get paid for that follow-up visit. So those kinds of CPT codes for office visits are listed on our website and on the simplified claim forms. You can do a diagnostic follow-up and a normal follow-up, but yes, we do want to pay you for any additional office visits that you provide.
Great. Is a breast MRI a type of imaging test that is covered by ScreenWise?
Yes, it is. And you will find that on, and I don't have it in front of me, so I can't tell you what page, but yes, we do cover magnetic resonance imaging for breasts. And I think there might be a couple of different types. So go ahead and check that CPT code list. I believe it is in the first few pages under the breast services.
Okay, thank you. This is a comment from Maggie in terms of just sharing with everybody here that there's been a lot of changes, a lot of changeover, I should say, and sometimes this information does get lost. So just verifying that these training sessions are really helpful and that the resources that we are able to put on the website, but as Wendy and Emily and Zeri have shared, we're shifting and making it more user-friendly. That so far that they are really great, and she has bookmarked them and uses them at least once a month. And intake and result forms are in that one, in her list of very needed, great items. Let me scroll. Thank you for all the questions. This is fun. And thank you, Terrell, for being, okay, good. They have a question at the end, and we'll make sure that we answer their question. And I'm just scrolling down. Another question. If a patient is enrolled in ScreenWise and is diagnosed with breast cancer, would we of course offer, or we would of course offer the breast and cervical cancer treatment program, but do we need to review with them that they may be financially responsible for consult visits? I'm speaking to the PowerPoint slide stating that we must alert the patient to possible charges.
So that's a good question. Thank you for asking that. If a patient is diagnosed with breast cancer, you would refer them to the treatment program. If they are not eligible for the treatment program, then you would go ahead and use the financial resources page and try to find other resources in the community to get them into treatment, to get their treatment covered. And if they need a a consult visit for their treatment prep. They may be financially responsible for that, yes, if they are unable to find, if you are unable to help them find other resources in the community. However, pretty much every hospital system has charity care or financial assistance programs, and I believe that most consult visits are covered. If a patient needs to come in for a surgical consult visit, that is maybe before she was diagnosed with cancer, or even right after they think that there's cancer, we do cover those surgical consult visits. And so those are also listed on our list of codes on the website. However, if it is part of her treatment, the ScreenWise program cannot cover it, and hopefully whoever is covering her treatment will step in and cover those. But it's always good to alert them that it's possible they may be responsible, but we really want to kind of close that gap and make sure that we know what that treatment is going to be, what treatment is going to be covered, so that they know ahead of time and can make their decisions and mentally prepare and that kind of thing.
I'm going to add a piece in here too, because it is such a good question. The portion that the clinics that all of you as our partners are responsible for is letting us know that the patient is getting treatment. You don't have to specify what the treatment is or what the treatment plan is, just the date that they had been referred. So we know that they're being followed for treatment and we can report that as such. And you are more than welcome to use your primary resources for financial assistance beyond the BCCTP program, especially if they don't qualify for that. If you have charity care through your hospital partners or through your whatever your workflow and your resources are, we have put together that the financial assistance resource pages as a backup to that, for especially for some of our rural providers and partners that maybe don't run across these diagnoses that often, and they get one and they call us and go, oh, what now? And since we're not the breast and cervical cancer treatment program, we're the screening and diagnostic portion, we wanted to put something together to bridge that gap and provide some additional resources, especially if a clinic or hospital system doesn't have those in place yet, something to start with.
Thank you. Next question. Can we make our own version of some of these forms so they are fillable?
We do want you to use, I think you're meaning the result and intake packet forms. They should all be fillable on the website. When you click on them, we recently, I think last week, we recently pulled down some, there were duplicates of some of the forms in different formats, and we pulled them down and we just have PDF fillable ones on there now. So you can print them out and handwrite them if you are in a good position that everyone can read your writing, or you can just fill them out right in there. And because it does ask for a signature, we do have the option for patients to be remotely enrolled into our program. And so on that, the intake packet on the front, the very first page on the top, it will have whether the patient came in or they were remotely enrolled, perhaps for a referral for their mammogram. You can then just type right on the signature line, and we put this in the instructions. You can type remote enrollment right in there. So there are some cases where the one thing that can't be done in person, like a signature, can be typed in. So if you have any trouble with those forms, if they're not working for you, just let us know. But we did clean it up just very recently, and all of those forms should be PDF fillable in all of the 6 languages that we have for the intake packet. And then the clinic facing result form and final outcome form is just a single option.
Thank you. And so an insight from Maggie, and this, I might need some clarification if you don't mind, Maggie, but the insight of I've had a patient who had lumps not get any testing because they would have to pay 100%. So just a little bit more background on that if you wanted to share, Maggie, or clarification.
Feel free to unmute yourself if you can. Or you can use the chat to further, and I can try to jump and answer this from an assumption that I have, and just feel free to correct me if I'm wrong. If you have a patient that didn't want to get any testing because it would be too expensive, that they just couldn't afford to do it because they were in a position either through lack of insurance coverage, or they're out of pocket, either one of those scenarios where they would have to pay a large amount, whether it was 100% or just 50%, and that was too much for them, they would be eligible if the other circumstances line up. So if that is what we're here for. If a patient, we want to prevent a patient from having to, if they live in Oregon or intend to live here and they're within the 250% or below the federal poverty level, and they're within those age areas where they qualify for our program, either for screening or diagnostics or both, we want to make sure that they can have this as an option to cover those costs for maybe with lumps. It sounds like a diagnostic, it could be a screening depending on what those lumps are made of, but that's for the physician to order. So we can definitely be here to provide coverage for that, so they're not going without because it's too expensive.
Thank you both. Next question.
It looks like Maggie might have clarified her question down towards the bottom. She had insurance and was just over the 250% income and was only 30 years old. I wonder if that's for clarifying.
2000. Oh, wow. Okay, that's a shame. Yeah, the 250% income, it's gross monthly based on household. So she must have, maybe it was just her, or whatever the circumstances were. It was going to be 2,000 out of pocket, single female. Okay, and she was 30. Now I think I saw this question elsewhere, and if I'm jumping around, I apologize, but it applies to the answer to this one. If the patient has lumps and she is needing diagnostic services, then she wouldn't, this particular patient wouldn't, she wouldn't qualify because she's not under that 250%, unfortunately. The other pieces she would qualify, being out of pocket $2,000 for her. And it sounds like it would have been a diagnostic maybe if the doctor had ordered a diagnostic and she was 30 or under, she would be eligible for our program, but because her income threshold puts her out of eligibility for us. If she's slightly over 250, we have to draw the line and stay within the Medicaid eligibility guidelines. And so, yeah, unfortunately, we would not be a resource for her. Yeah, thank you, Amy.
Thank you. Next question. So if a patient is under 50 and the provider considers it necessary for diagnostic services to be done, are they eligible as long as they have the supporting documentation?
Great. That was the question I saw when I was flipping through. Yes, they do not need any documentation. You don't have to send patient records. We request that you don't. We just want you to submit the forms indicating what services are being requested by the physician. That is the only documentation that we need. We don't need to know what the imaging result was other than the BI-RADS level, like all of the stipulations of the tissue analysis or the biopsy and pathology report analysis. We don't need any of that, just the directions of what services are being ordered to rule out cancer. So as long as the doctor has requested it be done medically necessary, then you're good. That's it.
Thank you. I think you answered the second part too, but let me, just in case, I've been wrong before. And are we required to submit any and all results to ScreenWise?
Yeah, you do want to send the results to us. If you're having additional diagnostics done, you want to let us know what those results are if they're enrolled in our program. So an add-on, an extra to this answer, because this comes up quite a bit, is if a patient, let's say they're eligible at the time that they sign up and they are enrolled in our program for 365 days. So in between the time that they may not have had an insurance and they've gotten a job now, 6 months later, they're coming in for a 6-month follow-up that the doctor wanted for them, to have some additional imaging done, or another, let's say a follow-up colposcopy, and they now have insurance. You can decide, depending on what the circumstances are. Some folks will think, some of the clinics will have the mind that they're good. The patient is being covered by an insurance now, and we want to make sure that you still report their final outcome to us once those testing results come back in, because for everyone that's enrolled, we need to report on what happened with that patient. So yeah, that is a question that just came up today. So it was timely.
Perfect. And just a quick FYI, so it is 3:25 by my computer. And so I wanted to make sure that I stick to the commitment of having this completed by 3:30. So this will be our last question, but please feel free, if you have any more questions, anything kind of continues to percolate, you go to sleep and you have a mountain of questions in the morning, no worries. Please feel free to either call or email your questions and we will get back to you. And so our last question, does the BCCTP Breast and Cervical Cancer Treatment Program have an application form to fill out like the ScreenWise? How do you set up a patient with that?
Zuri, do you want to take this question? Because you're probably the expert on this.
Sure, I could try to answer to the best of my knowledge. So yes, there is an application and it is listed on our website. There is an application guide that will also guide providers into who would be eligible for this, for the coverage. It has to be filled out by a provider. It could be a primary care or other provider working with the patient to support with cancer treatment. So BCCTP is essentially an extension of Oregon Health Plan as plan. So yes, a provider can fill out that application, send it in, and then there will be a revision of the application. There will be a presumptive eligibility, and then the patient will be able to access treatment services within, my understanding is within a month period or sooner. I hope that answers the question. And maybe I froze.
That's great, Zuri. Thank you. I'm just going to add one more little piece is that I know that a lot of you are familiar with it. Used to be that a patient had to have been diagnosed with cancer through the ScreenWise program, and that went away. That requirement went away a few years ago. So now it is that anybody can use the treatment program. They do not have to have been diagnosed through ScreenWise. So that you can use that form for any of your patients who get diagnosed with cancer who are in need of treatment.
So no more questions. I don't know, as in the last 2 minutes or so. I don't know if Wendy or Emily or Zuri have some closing insights for us.
Well, we just want to thank you all for everything that you do to help patients in Oregon receive these services that are so important and that they wouldn't normally receive otherwise. Thank you for all that you do.
Thank you for
Thank you.
being here. And please feel free to contact anybody that's listed. And you also should have a copy of it. It's on the back of the presentation that was sent to you a little bit earlier this week. Feel free to reach out with any more of your questions, anything that percolates later on today or tomorrow or even Friday. Or as Amy had found a link that perhaps isn't functioning as well as it should, just let us know and we'll get the correct information on there. Other than that, I mean, have a great rest of your Wednesday and enjoy this dryish weather and some sprinkling of sun, I think I see outside. And that is it. Have a great afternoon.
Thank you.
Thank you.
Thank you.